Hi, good afternoon, everyone, and thank you so much for having us. As David mentioned, I'm Carmina, and I'm a research associate at the Institute for Gender and the Economy. And I'll be speaking today alongside my wonderful colleague Laura, who is a PhD fellow at our institute, about care work in the recovery economy and some of our ideas about how care can and should be viewed and valued. So just in addition to our article in Rotman Management magazine on this topic, if you're interested in learning more, you can head over to gendereconomy.org. And we have a full report that we released about care work during and after COVID-19. So care work is really at the center of our economy, our society, and our well-being. And it's a foundation on which all of us stand. Without the crucial work of care, really none of our economic sectors could function the way they do. Care work ensures that we and our families can be healthy, we can learn and grow and work and thrive. And when I'm talking about care work, I'm talking about caring of all kinds, from nursing to personal support work, from nannying children to taking care of a sick relative. And this work can be paid or unpaid. And a lot of this work also tends to include advocacy because when affordable and accessible care is not part of the system, then it is paid and unpaid caregivers who have to advocate for what they need, whether that's an appointment with a specialist or for fair wages if they're a care worker. So when you picture a care worker or a caregiver, who do you think of in your mind? I think for many of you and for many of us in general, it's likely a woman. And one reason why care work tends to be sidelined or really viewed as unimportant in our society is because it really is distinctly gendered work. Care, both paid and unpaid, is often seen as women's inherent responsibility. And there are a lot of stereotypes and norms that women are innately carrying, that they do this work because they enjoy it and that it just does not require much skill. And these stereotypes have become justification for underpaying and ignoring care workers in policy. One recent example that we've actually seen is that with plans to create an affordable childcare system here in Canada, there have not been many plans or discussion about raising the salaries of early childhood educators to a more livable wage. And care work is also really racialized and tied to migration. In Canada and in other Western countries, paid care workers are disproportionately people of color and immigrants who are again paid very little and have few protections such as paid sick leave. So thousands of people who have entered Canada as caregivers, and even though they provide this crucial work to our communities across the country, they do not often receive resident status for many years. But I'm sure, as many of us know, care work is extremely tough and it does require a lot of skill. And especially, I think anyone who has had to take care of kids or dependents during the pandemic will be really familiar with this. Unfortunately, the undervaluing of care work has really led to distress and mental health issues for caregivers and care workers during the pandemic. And we've seen that nurses, personal support workers, and early childhood educators in Canada have reported burnout, job strain, work stress, hopelessness, feelings of exhaustion, and more. And when the work of paid and unpaid caregivers is neglected, everyone being cared for suffers as well. So when we don't support and value our systems of caring, then we're not supporting ourselves and our communities. Another reason why care tends to be really undervalued is because it is very difficult to measure, and it usually goes unrecorded in national and global statistics. So remember that a lot of care work is unpaid. That does not negate its value to our society and to our economy. A recent Oxfam study that was reported on by the New York Times in 2020 actually found that if women around the world were paid minimum wage in their countries for their unpaid work in 1 year, they would make nearly $11 trillion total. And it's clear that care is really hugely important to our economy. Research has found really a lot of clear economic benefits if we better invested in the care economy and in care workers. Providing caregivers with care supports, such as affordable childcare and elder care, paying care workers fairly, and ensuring that everyone can access care for their health and well-being has been proven to result in more good jobs, more women in the labor force, and a more educated workforce overall. And actually, the International Labor Organization recently estimated that pandemic recovery that invests in the care economy by instituting measures such as universal childcare, paid childcare leave, breastfeeding breaks, and long-term care services in 82 countries around the world could create a GDP growth of 3.6% globally. Now, at the same time, we also shouldn't only value care based on how many dollars it is worth or how much it can grow our economy. And in fact, there's a danger in perceiving care as solely transactional, solely about economic growth and gain. If we think about care as just any other sector that contributes economically, then we're missing out on some of its crucial social benefits. And this line of thinking has led to what many have called the financialization of care. So I'm going to pass it over to my colleague Laura to talk a bit more about this.
Thanks, Carmina. So the importance of care work beyond direct economic benefits is often forgotten when we simply look at how can we profit from care. And researchers have noted that when the framing of care simply comes down to economic benefits, rather than simply having a right to access care, that can become very problematic. And currently in our world today, with economic and political spheres, with commentary on rising inflation and government debt, the trends of arguing for the economic benefits of care are accelerating, and these trends are becoming reasons to reduce or to reverse investments in government-supported care programs in order to favor market-based solutions. And increasingly, this focus, even by advocates for greater public investments, is often for the business case of care. So, for example, in early childhood care education settings, these are viewed as spaces that children can stay while parents can make a living and create economic outputs. However, we don't view these spaces for learning that have a significant influences on children's lives and over the lifetimes in their communities. These outcomes can influence the children's futures, and they require time. Societal impacts are not quantifiable immediately and cannot be solely assessed on economic value. And for-profit models of care have proved mainly ineffective in providing quality experiences for both the care workers and the care recipients. Some of these market-based models for childcare have pushed up prices that are completely unaffordable, and we are seeing that there's a need to make care more accessible and more affordable. At the same time, early childhood educators have dealt with low wages and few benefits that Carmina has mentioned. In another example, for-profit long-term care homes have resulted in very poor conditions during COVID-19 outbreaks and resulted in deaths and illnesses for many of the residents and workers. So our key takeaway for you is this. The conditions of work are also the conditions of care. And if we don't have fair wages for care workers, solid employment benefits and protections like paid sick leave and health benefits, and increased training opportunities, this can be problematic for our overall care infrastructure. These are important and crucial needs to be met, and we need to create a solid care infrastructure that cannot be simply transactional. Beyond market-based approaches, we are seeing positive outcomes for not-for-profit institutions. Cooperative models are already filling gaps in care provided by private or public systems, and care cooperatives provide some form of support for the elderly, care for persons with disabilities, childcare, and domestic services. When we talk about the future of work, frequently the conversation centers around how automation, artificial intelligence, or tools leveraging machine learning can come into play. Care is no exception to that conversation. Technology has been introduced as another potential solution to increase value and access to care, and the pandemic has showcased the potential benefits of the technology use. We are seeing people use digital health appointments that reduce the amount of human contact between doctors and patients. We're also seeing in some countries that robots are introduced in long-term care homes. And in certain care settings, it's true, care technologies are assisting with managing the demands of care as a solution to care shortages and care facilities. Yet, we caution that technology cannot be a catch-all solution in terms of all the gaps in the care economy. And that is because care researchers have argued that care work is simply not replaceable by technology due to its highly relational nature. When we talk about relational, think about interactions and connections needed to provide care for somebody, as compared to work that is simply like delivering a package, preparing food, writing a book. There is an amount of humanity required for both the care receiver and caregiver between each other. It is a mutual interdependence. Caregivers must manage both how the technologies deliver practical aspects of care and how they might meet the emotional or relational model needs of care recipients. So instead of looking at replacing care work with technology, we can look to care technologies being more likely to improve care conditions and interactions by assisting. And in line with that, we must also look to who is benefiting from technologies in care. Some technologies are enabling greater access through digital communication and access between parties such as a paid caregiver, an unpaid caregiver, or care receivers alike. However, these interactions can be beneficial for all parties, yet these technologies can also shift the responsibility of care to others, continuing to blur lines between the personal and professional lives, such as for working parents simultaneously balancing both work and care for their dependents. We must also think about how this technology can also disrupt time that caregivers tend to spend with their own families. And oftentimes in the Canadian and global North context, immigrants supply the labor to care for families with working parents, and they're often the ones that sacrifice their own time with their families. And in another example, the proliferation of gig work is also very prominent in the care economy. Gig work for care, in theory, is designed to ease concerns about safety and security for both ends of those needing care and those providing care, protecting both caregivers who are charged of care responsibilities and the care receivers who are asking for help. However, research has shown that these technologies may actually reinforce or exacerbate the asymmetries of power. For example, during the pandemic, digital care platforms were found to monitor the health of care workers to ensure that families that they were working for were protected from COVID-19 through vaccinations. However, this is not an equal requirement on the other side. Families were not required to do the same, and care workers did not have the same protections while they were working. We can see that there is an inequality in how technological solutions are experienced. So we want to end on this. There is a need to examine how we value care. This includes looking at how we put value beyond economic dollars and cents. Examples that we used earlier today on early childhood education demonstrates that the quality of care is crucial, and there must be a long-term focus on impact. We need to look at who is involved in care. Care worker voices are often missing from key policy decisions, their work simply taken for granted. And lastly, we want to invite creativity in thinking beyond market-based for-profit care systems, and we can harness opportunities from co-ops and not-for-profit models to improve how we value care. Thank you for your time, and I will now pass it off to David.